Good morning, Nashville. As I mentioned yesterday morning, the Metro Coronavirus Task Force is working on a data-driven economic reopening schedule in close cooperation with the state, local business leaders, and public health experts. As a reminder, the latest COVID-19 data that the Metro Public Health Department has received indicates that Nashville could enter Phase 1 of our economic reopening in the first part of May if we as a community achieve the following requirements. A rate of transmission of less than 1, meaning each individual does not infect more than one other person in Davidson County. A 14-day downward trend in new cases of COVID-19. Adequate testing and PPE capacity for our region, and a robust public health infrastructure to conduct contact tracing through investigations throughout our community. These objective public health targets are part of our strategy to get Nashville back to work in a safe manner, while also ensuring our local healthcare providers do not become overloaded in the event of a spike in cases. We look forward to presenting details of our phased economic reopening plan with you tomorrow, but remember, we must work together to keep the number of coronavirus cases down throughout Davidson County, lift the safer at home order, and begin returning to business as normal. So I urge everyone to continue remaining at home whenever possible. Only leave your homes to run essential errands. Wear face coverings when social distancing measures are difficult to maintain. Now, as we heard from Metro epidemiologist Leslie Waller yesterday morning, we are carefully monitoring COVID-19 patterns in our community and partnering with the Tennessee Immigrant and Refugee Rights Coalition as part of our response. We're grateful for Turk's partnership with the Public Health Department and their leadership, especially in the Southeast Nashville community, where we are working together to address a large number of confirmed cases. Another critical part of disease investigation is the gathering of COVID-19 race and ethnicity data. This data helps us better understand how the virus is affecting our community and how we are responding to it. And Dr. Alex Jahanger will share more details about this data shortly. As a reminder, if you suspect that you may have COVID-19 and are worried about the virus or simply have questions, do not hesitate to call the Metro COVID-19 hotline at 615-862-7777, which is open 7 days a week from 7 a.m. until 7 p.m. Now, during the call, you may be directed to one of our community assessment centers, which are open Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. for further assessment and testing. All services, including the COVID-19 testing throughout the community assessment system, is free to all Nashvillians. Now, this morning, I want to welcome Sheriff DARON Hall of the Davidson County Sheriff's Office, who's joined us to provide a COVID-19 update regarding the DCSO system. I'm grateful for Sheriff Hall's leadership during this challenging time and all the officers and employees of the DCSO who are in the front lines of Metro's COVID-19 response. To those Nashvillians who are in need of direct financial, food, mental health, and social service assistance, I urge you to visit the covid19.nashville.gov to learn how to obtain direct relief through the COVID-19 Response Fund. And to those who are able to contribute, please visit the website to donate to the Response Fund, which is providing much-needed assistance to our neighbors during this time. Now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here's the latest on the COVID virus in Nashville and Davidson County. We have 1,962 confirmed cases, with a total of 22 fatalities. That is an increase of 26 cases over the past 24 hours. There are also an additional 1,764 cases in our surrounding counties, bringing our total for the region to 3,726. Of the Davidson County cases, 913 are currently active, and 1,027 residents have recovered from the virus and have been cleared. This morning, we have additional information to share. Of the Davidson County confirmed cases, 40% are white, 13% are Black or African American, 12% are multiracial or other, 5% are Asian, 6% are unknown, and 24% are pending. And of the 22 Nashvillians who have died, 10 are white, 9 are Black or African American, and 3 are listed as others. We will continue to update these numbers every day. Now, it is important for us to analyze and understand this information, as well as the heat map data we shared yesterday, as we continue to fight the coronavirus. It impacts those who are most medically vulnerable the hardest. And like other medical conditions, this virus is highlighting the impact of health disparities in our society. Minorities and those with limited access to health care are most seriously impacted disproportionately. As you can see, while Black Nashvillians make up 13% of the confirmed cases in Nashville, they comprise nearly half the deaths in our community. Next week, I will also report the breakdown by race of the individuals tested at our community assessment centers. We need to ensure that Nashvillians who need a test are getting a test. And as Dr. Hildreth stated yesterday, the best way to make an invisible enemy visible is to test, test, and test. That's one reason we place the community assessment centers in the communities where people may not have easy access to health care. We have said from the beginning that we're all in this together, so it's vital that we have resources available to everyone. If any resident of Nashville believes that they have the virus or may have been exposed to the virus or are just worried, please seek medical attention, either with your local healthcare provider or through our community assessment system. As our mayor stated, please call our assessment hotline at 615-862-7777. It's open 7 days a week from 7 a.m. to 7 p.m. You will speak to a medical personnel who will answer your questions and give you guidance. And today, the community assessment centers are open until 3 p.m. The 3 locations are at Nissan Stadium, at Nissan Stadium, at the Kmart in Antioch, and at Meharry Medical College. So far, more than 1,400 people were assessed at the centers on Monday and last Friday. You can drive up or walk up, and there have been little to no wait, and there's no cost to you to get a test. Now, as the mayor stated yesterday, we talked about reopening our city and restarting our economy. Here's how it will work. We will make sure to use data and science to make our decisions. As I've said before, we are looking at transmission rates, the 14-day trend of new cases, contact tracing resources, testing capacity, PPE supply, and hospital capacity. These metrics will drive our decision on the timing to restart our economy. Along with the other major cities in the state, we'll continue to work on the specifics of how businesses and facilities will open up. It will happen in 4 phases. We took a measured approach in closing down, and we'll take a measured approach in opening up. We'll have more details tomorrow. For now, the most important you can do is to continue to do what you are doing. This is not over. We need to stay the course. Remain vigilant and fight the virus by staying at home, unless it's absolutely necessary. That way, we can get back to normal sooner, and we'll save lives. Thanks for your help and support. Together, we'll keep Nashville safe. I now would like to introduce Sheriff Darren Hall. Thank you.
First, I want to thank Mayor Cooper for his leadership for our city in the unprecedented times, and also for inviting me as the sheriff here to talk about a subset of what Dr. Hanger just talked about. This data is within the numbers that he's spoken of, but in our own little city that we operate inside of the jail system, I think it's worth and important that our community understand what is going on. To date, we have 1,003 people who are incarcerated in our jail system. And of those 1,003 people, we have 119 of those in some form of medical restriction as a result of COVID. There are 3 categories within our system of that restriction. One may be those who had extreme exposure to a positive case inside of our jail system. Another category is those individuals who are symptomatic and awaiting test results. And we eventually have 11 positive cases now within our jail system that are also isolated. The Sheriff's Office in Nashville comprises of about 873 employees throughout our city in a variety of functions. The vast majority, some 600 of those, work inside of the jail system that is really in question here today. We have tested over 200, nearly 300 people that work for us. And we have to date 7 positive employees and 1 who has fully returned and recovered and returned to work. I do want to make just a point about that. Often law enforcement and frontline is the word used all over our country when we're talking about this difficulty for all of us. And the healthcare field, by all means, is the front line in every case of this. But the folks working in the jail system, it's a challenging day and a challenging place to be. And I just want to thank those who are working there today, not only in Nashville, but all over this country. Just yesterday, there was a deputy who lost his life in Shelby County, Tennessee, as a result of COVID, and there were others in Chicago and Ohio as well. Chief Anderson and I have spoken of this, but the truth of the matter is once we arrest an individual in this community and put them in jail, the exposure risk is far greater on the employees now living and working inside of a jail system. So we just want to keep that in mind as we all go forward. Very proud of the men and women who chose this line of work and are doing extreme work in our system today. Very fortunate, Nashville is very fortunate to have a system, I think, that has worked with us to reduce our population. That's been important to allow us to separate individuals once you have these cases entering our jail system. And we really need to continue that work as we go forward. The police department, the district attorney's office, the judges have all been very helpful in moving our numbers to a point where we have the opportunity to isolate individuals. Nashville also has another fortunate thing that has occurred. Many of us have heard of our new facility we had planned to open later in May. But as a result of these numbers and some work with the health department and others, we really needed to open that facility up to be able to separate the cases from one another and obviously populations in our jail system. So we are running our new detention center downtown as basically a medical ward, medical wing while we get through this crisis. Other things, just to let everyone know, our staff are tested every day on their temperature upon arrival. Every inmate is tested upon arrival on their temperature. Every inmate in our system is provided a mask, as well as our staff. We're living within, as best we can, the social distancing is almost impossible in a jail setting. But I'm very proud of the work that we're doing to try to minimize the risk to staff and inmates, who, by the way, every one of these individuals will return to our community. So it's very important that we gather the information and treat them well within our criminal justice system. So thank you for allowing me to be here today.
Thank you, Sheriff Hall. We will now start the Q&A segment of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Nikki Genowitz from Fox 17. Nikki.
Yes, good morning. This question is for Mayor Cooper. In your State of the City address, you said that body cameras are coming. Have any been deployed yet, and if not, when?
Thank you, Nikki. Mayor Cooper.
Well, thank you, Nikki. Appreciate that question. Actually, it's, I think, the first back-to-business question that I've had in more than a month. Yes, body cameras are coming. However, in the current budget environment, we have to just continue our pilot program, which was rolled out on March the 1st. Pilot program is going to have to be carefully done to make sure we're making good vendor decisions with equipment and a process that everybody from the DA's office to the public defender's office to the police department can follow. The conclusions from our pilot program are not in yet, and our ability to fund a deeper program will obviously be delayed by the budget crisis that the city is under right now. But with your question, I look forward to these kind of things rolling out in Nashville as we get back to business and serving our community in a better way on the other side of the virus crisis.
Jeremy Finley, News 4. You're on the air, Jeremy.
All right, thank you again, everybody, for taking our questions. I have a two-part question, one for Dr. Jahangir and the other for the mayor. Dr. Jahangir, the first question is, as these counties surrounding Nashville open, is there concern that there would be an uptick of COVID-19 cases, that there wouldn't be hospitals in those counties to handle the cases, and then those patients would end up in Nashville? And I'd like to know what the plan is for that for that scenario? And second, Mayor, I've wondered if this had also crossed your mind, and if you communicated that to the governor about patients from more rural counties, flooding Nashville hospitals in case there is an uptick. Thank you.
Start with Dr. Jungir.
Yeah. Jeremy, thank you for your question. Again, and I've said this before, we're very fortunate to live in a city that has some amazing healthcare facilities. And that has always resulted in people from all over the state and other states to come to us for care. That won't change if we start seeing an increase in COVID cases, which that's why we want the data to drive us as we reopen, and as I would recommend that our surrounding counties follow our lead and follow the data to allow them to open themselves. Now, with that said, one of the metrics that we've entered in our system is hospital capacity and PPE. So we're going to keep a close eye on that. I've spoken just yesterday. I spoke with the CEOs of every health system in our city, and they've confirmed with me exactly what I just told you. I mean, they'll continue monitoring this. They'll want to take care of people. They each have their own surge capacity. And in addition to that, the state and the Unified Commanders still have a alternative care site planned for Nashville to allow for even an additional surge. So I hope we don't have to use any of that. I hope we will all follow the data and open up in an intelligent, data-driven way so that we can handle an increase in capacity. But if it's not done correctly, that's a concern. But our hospitals and we as the city here are very cognizant of that and are going to be a very stepwise fashion through that. Thank you.
So, Jeremy, thank you. You wanted asked for me to respond. If a surge threatens capacity, we will respond. And I think that's a consistent attitude from our healthcare leaders that I've talked to yesterday and the state. Of course, if a surge threatens capacity, we will respond. In the meantime, Nashville is a regional healthcare center, and we're not going to give up that leadership, and we will serve all the people who have traditionally depended on Nashville in providing health care going forward. But the short answer of your question is if there's a surge, of course, everyone agrees we're going to respond and respond in a meaningful way. Thanks.
Tosin Fakile, News 4.
Thank you, Chris. Good morning, everyone. My first question is for Dr. Jahangir, and it's in two parts, and then the other one would be for the sheriff. The first one is, did you guys happen to maybe talk with businesses in Nashville as you were making these plans for reopening? And if you did, what were those conversations like? And still, the second part of the question for Dr. Jahangir. So with the opening planning coming up, what does that mean for the community assessment centers? Are you guys scaling back, closing it? What would the dates be for that? And for the sheriff's office, I was wondering if he has any concerns or fears with so many people in a small space. Is he worried about more cases popping up? If he has any concerns about that. Thank you.
Dr. Jungir.
Tosin, thank you for your questions. So the short answer is, of course, we as Nashville have been working with our business community. The chamber is very involved in getting feedback and helping shape the document. But even beyond that, as we're working with the three other major cities, their business communities have been involved in this process. There are subgroups of the more larger metro task force that's focusing on business and other industries. And so there's a lot of feedback. That's why this document wasn't given to you yesterday, right? We're incorporating feedback. We're evaluating this. And as the mayor said, hopefully tomorrow we'll have this thought out plan to present, taking feedback from every sector. Regarding community assessment centers, and I believe you asked if we're going to roll them back, one of the metrics that we also talked about is testing capacity. Our community assessment centers are working well. They're testing people. You're worried about it, come get a test, and they're free. And so we need to keep a certain capacity of testing to make sure we understand how the virus is acting in our community, and so there's no plans to roll those back, and we're going to continue and advocate for people to come get tested. So so we'll keep doing that. Thank you.
Yeah, I think the question was about, are we concerned about the space inside of a jail facility and the exposure risk and more numbers? I think the answer is yes. Anytime you run an operation like we run, we need to be aware that the risk is there, and we expect those numbers to go up. There's a prison system in Ohio right now that has 2,000 positive cases inside of one prison. You can just go throughout the country. Most jail systems and prison systems are struggling to keep the numbers down. We expect our numbers to go up, but we want to make sure, working with the health department, that's directly every day, and making sure that we're meeting all the standards of care. But you are talking about dormitory environments sometimes where 100 people live maybe. And once you have a positive case, which is what's happened in our system already, then the risk of exposure to other inmates is very, very high. And so we're working very hard to minimize that risk, but we're expecting those numbers to continue to go up.
Nikki, you had a follow-up question?
Yes, thank you so much, Chris. This is another one for Mayor Cooper. So just so I'm clear, I guess it's a two-part question. 26 cameras were supposed to be deployed for traffic and DUI officers in March. Are those 26 cameras on those officers, A? And B, when we talk about a delay of a full program, we're talking 1,000 days after funding got approved for the program. How much longer are people who feel passionately about this issue going to have to wait?
Mayor Cooper.
I believe the pilot program is rolling out the 26 cameras, from which the pilot program is going to educate appropriate vendor decisions for a larger program and indicate accurately the costs of implementing the full program. Now, next Tuesday, we'll be having a more detailed budget message, but I don't think it'll be a surprise that the city, in the current COVID-19 crisis era, is not able to find the money to extend this particular program at this time. There are many worthy things that we're going to have to take a breath on as the community moves through to success on the other side of the crisis. The multi-$100-million hole in our budget still has to be filled, and all the worthy things that we would like to do to create a stronger city, or we're going to have to concentrate on being healthy first.
Julia Palazzo, WKRN.
Good morning. Thank you, Chris. Two questions. First, for Mayor Cooper, you mentioned, of course, having enough personal protective equipment, part of the criteria for reopening. Do you plan on issuing a type of order for everyone in Nashville to always be wearing a mask when they're inside businesses and reopening begins? And then my second question is for Dr. Jahanger. Just wanted to get your reaction to the governor. He said yesterday, he and his team during the press conference, that they're not really looking at the 14-day downward trend. They're looking at the percentage of cases increased instead. Why do you think it's better to follow the 14-day trend? Do you think it's a problem that you guys are not on the same page? Thank you.
Mayor Cooper.
Thank you, Julia. I'll talk about this. Yes, masks will be part of protocols going forward as we identify their value in particular ways of serving the public. I think masks will, of course, be one of the tools. Now, masks alone are not going to completely create safety, the appropriate level of safety, but I think everybody should look forward to a period of time of being requested to wear masks in certain situations, of which the restart plan will identify the times where masks are going to be particularly useful in keeping us all safe.
And regarding your question, I think I didn't hear what the governor said or didn't say yesterday, but what I can tell you is the science shows that there's several metrics that show for having success. 14-day downward trend, doubling time, the transmission rate. There's many different metrics that one can look at to see how a definition of success or not against this virus. We're going to continue using the data and science to continue to determine the decisions that are made as a city. Thank you.
Sam Zern, WPLN.
Good morning, y'all. My question's for Sheriff Hall. What does testing capacity look like in jails at the moment? And as far as mitigating the spread goes, is there space available for isolation as needed? And as people are being released, are they advised to self-quarantine?
Sheriff.
Yeah, I think a couple things about that. The testing is on an as-needed basis. Our staff, the medical staff that are on site, once a person's symptomatic, is isolated and then tested. And one of your question that's very pertinent is it depends on the housing arrangement of the individual. Here in jails, typically the lower level security inmates live in larger environments. And so what's happened here is in our lower classification inmates, those are dormitories. And so what we've had in the last couple of days and week is some positive cases within the dormitories. And what that really means is it restricts the movement of all of the other people who live in that dormitory. And so we do have many isolation units, given the fact that we have a new facility opening, but that has limits, and we're going to work over the next week or so. We hope to be able to exhaust all of that. Hopefully we'll have plenty to do that with. Your question was, upon release, are they told to quarantine? That is completely a medical decision. The good news here is that the health department oversees the health care of all the inmates, and the health department obviously is in the field in our community. And so if a person's released, needing to be quarantined, needing follow-up care, that's at the direct care of the health department.
Nancy Ammons.
Thank you. I have another question for Sheriff Hall. I know some systems, prison systems, state prison systems have been under a lot of debate over whether they should be testing every inmate. Does he see a situation where he would be testing every inmate? And also a question for Dr. Jahanger. Why the decision to allow anyone who's worried to go ahead and get tested? Thank you.
Start with Sheriff Hall.
Yeah, thank you, Nancy, for that question. I think I have evolved in this watching and learning. Of course, I'm not a healthcare expert at all, but I'm confident and comfortable with where we are as it relates to testing. Once there is a positive or symptomatic inmate in our system, we're immediately isolating them. Then the health department and our healthcare provider are in the unit in which that positive case originated, ensuring any symptoms are then obviously moved out. The reality of it, and this is the way it was explained to me, and I believe this is fair, is you'd almost have to test every day, every inmate to feel confident that you're really doing what I think the question I asked. And so I feel comfortable right now. Our worry is making sure we have enough space to isolate those cases that are positive, and the amount of testing that is being conducted, I believe, is adequate for where we are today.
Nancy, so as we've progressed through, we started our community assessment centers on March 31st. When we first started the community assessment center, if you remember, we waited until we had enough supplies to be able to conduct a standard of care at that time. At that time, the standard of care for testing in our community was anyone that was symptomatic with fever, shortness of breath, or cough. As the indications have expanded, both in our community and elsewhere, we started expanding our indications. And we've also been very fortunate to secure our supply chain of supplies. So because we can meet the demand and because we have the capability to keep up with standard of care and provide testing for Nashvilleians who are worried about it, that's why we're expanding. And so it's just that we're letting the science and the data and the best practices drive us, and that's why we're where we're at today. Thank you.
Chris Davis, News Channel 5. Go ahead, Chris.
Mayor Cooper, first, if you could respond to the state's decision to go ahead and try to move forward on moving the opening of the state by the beginning of May. Do you think that's the right decision? And then secondly, you've talked a lot about the city's poor finances and now a property tax increase is likely. Do you have support for that on Metro Council this year, and have you determined how much that hike may look like?
Mayor Cooper.
We haven't determined the property tax hike as we work away this week finding money in order to do the best job that we can in managing the city so that essential services are not disrupted. Many cities are confronted with difficult things such as furloughs and layoffs, which we are doing our best to avoid at this time, and there'll be more details on that next week. In terms of the background of the state's decision, I can't say. I think the state, as are we, extremely encouraged by the recent testing results, and that the ability to restart the economy is something that we are both looking forward to. We've not gotten to a date-specific number at this point because we're waiting for the data to come in, and then also to establish, to lay out for the different parts of our economy good rules for keeping everybody safe. Safety is part of Nashville's image, and we need a safe reputation to be successful in the reopening of our hospitality, our healthcare, our schools, our university. And we have an obligation to get people back to work, but also all the employees safe. They don't need to take unnecessary risks in serving the public, and we also need to keep the public safe. That is a balance that has to be negotiated and can be done by a thoughtful application of good social distancing practice, one industry group at a time. And again, I think we're going to get to the point where we can actively talk about it. But for your viewers and everybody else, let's go back to the basics. You are making it possible to remove safer at home by your actions, by your commitment to social distancing, to lower the spread of the virus allows us to get back to work sooner. This is a report card, a little bit every day on how effective we are at social distancing. It's a very hard thing to do against a very difficult virus, but we are making progress right now. And if we can finish this out, and in the weeks ahead, I want to urge everybody in the days ahead to be extremely careful, and let's not blow our declining data trend line. Let's keep that going so that we can get all the way to the restart. It's never been more important than right now. Every positive case will delay the ability to restart. Our degree that we can follow social distancing is the degree that we can get back to work sooner. And also, let's be realistic, Chris. We're going to have to continue social distancing practices even after the economy is restarted. The virus is going to be with us for a long period of time. We have to learn how to do this safely, one job at a time, one customer interaction at a time, but we can do it. And we're happy to do it because we know that that's going to be tons better than the quarantine conditions that we've been under for the last week. So let's not blow our good work and finish the job. Thank you.
Stephen Elliott.
Thank you. Thank you for sharing the mortality data. Do you have hospitalization data similarly broken down by race or ethnicity or primary language?
In short, not easily accessible today to be able to provide that. So I'm sorry, I don't have that right now. With our public health department can break that out. I just didn't get that report. So I'll try to get that for you. Thank you.
Our last question is from Harriet Wallace at Fox 17. Harriet?
Good morning, everyone. I would like a response possibly from Mayor Cooper or Dr. Jahanger. I've received complaints from employees at about 4 different companies. They're concerned with the fact that they are essential workers, that management and ownership, they say, are concealing the fact that some employees have been sick. They're not following CDC guidelines to clean and to isolate and inform. But I know we only have a handful of health department inspectors. What is the plan to address this issue, and has there been any discussion about adding to the inspector staff as you have other groups related to fighting the virus? Thank you.
Thank you, Harriet. Dr. Jahangir.
Very good to hear from you. In short, listen, every employer has an obligation to make sure their employee is safe at the workplace. And if there is an incident where this is not happening, I encourage the employees, or if you know the information, call them in. You can call 311, you can go to the hub, and our inspectors will evaluate that. And to your question of will there be enough inspectors to ensure that we can take care of this, the answer is yes. As the need exists, we'll make sure that we keep up. But please ensure that all workplaces are safe. And if you're working in a place that's not safe, call or go on the website and let us know. Thank you.
That's all the questions we have in the WebEx queue at this time. A recording of this press briefing will be made available.
All right, everybody, we are watching the Metro Nashville daily briefing there about the coronavirus here. You know, we've been checking in on this every day, and for the first time, I think today, Mayor Cooper was posed a question that was business related for something that we were covering in the news here months ago, and I think his answer really pertains to what's going on now. He was asked twice about specifics on body cameras. Obviously, 2 months ago, this was a huge deal, but his answer to that is they simply don't have the money to extend the program. They're still in the pilot program, and he says they're going to have to wait to see this pandemic through to make this decision. And really, he went on a little bit later to talk about they're finding more money, that they're already in a budget deficit, and he pointed that out, $100 million, and now it's made even worse. They're trying to manage this money so the city's essential services are not disrupted. So a lot of these things, a lot of these big news things we were covering are really put on hold as they try as hard as they can not to lay off and furlough people. And then, Holly, one of the last things that Cooper said was, again, it's up to each one of us, all of us at home watching right now, to be able to reopen businesses. Keep our distance, stay at home, and we'll reopen as soon as we possibly can.
And right now, he's saying it's going to rely on this main data. It's all going to be data-driven. If we achieve rates of transmission less than 1, that's talking about the spread of 1 person to less than 1 person, 14-day downward trend, and that's what happened, the big problem over the weekend, because it spiked by 25%. Also, this adequate testing and PPE, the protective gear, that we have enough of that, and the robust health of infrastructure. So tomorrow, heads up to our community, everybody out there, tomorrow is a big day, and that's when he's going to walk through the 4 phases of this possible reentry. What will happen when we are able to reopen the economy here in Davidson County? So we'll continue to follow all of this. Of course, the very latest. Always love having you with us, Chris. And be sure and join me at noon coming up in just a couple hours for the very latest. Also online, WSMV.com, and our News 4 app. Just search WSMV. Thanks for joining us.